Hello and a warm welcome. You're watching India Tonight with me, Jude Sanath in Chennai, and my colleague Shibani Garat joining in from the Mumbai studios. It's a bit of a discussion that has been a long time coming because skyrocketing hospital bills have emerged as a major concern in the healthcare sector. In fact, it's not just surgeries, procedures and treatments, but also hospital room tariffs that add to a patient's worry. Now, a parliamentary panel for health and family welfare has recommended capping hospital room tariffs. Shibani, some relief there for patients for whom this has been a long-standing grouse to do with India's
Absolutely.
healthcare
Ask
sector.
me about it. I was just inside the hospital just as of last week, Jude. So this recommendation has in fact triggered a widespread conversation on why this healthcare reform is necessary and transformative step to change, in fact, the healthcare landscape in India. But will it be feasible for the hospitals? We will discuss it on this edition of India Tonight. But before that, Merrill breaks down the economics behind the hospital tariffs.
That's right. So, a parliamentary health committee has just recommended a bunch of changes, and one of them is capping hospital room rates at the same tariff as nearby three-star hotels. Now, what this is aiming to do is address the major gap that is currently in place among healthcare costs. We're seeing average hospital costs as of now stands at around 50,500 for a hospitalization in a private hospital versus 6,600 in a public hospital. This makes private healthcare up to 5 times more expensive and up to 10 times more expensive in certain metro cities. But apart from this, the committee is also recommending fixed package rates for standard procedures, upfront cost estimates that is that can be legally enforced upon the hospital for the complex treatments, and also greater transparency in bills as well as insurance. On top of that, they also want the government to expand the public healthcare capacity, and they've also called for a review of FDI rules around foreign ownership and management of existing private hospitals. So while this is only a suggestion as of now and not a government mandated cap, any future implementation on this could have a meaningful impact on private hospitals' pricing, profitability, and also how much foreign investors can actually invest in these hotels. We've seen a lot of foreign-owned hotels, especially now the major Manipal Health IPO, which is largely backed by Temasek Group, and a lot of major hospital brands are also backed by FDIs. So even that is why we're seeing the certain moves in hospital shares right now. We're seeing the likes of Apollo Hospitals, Max Healthcare all fall down on the back of this parliamentary committee hearing.
Well, a slew of recommendations there by that parliamentary panel like Merrill was explaining. But to join us in discussing this in detail, what it means for India's healthcare sector, insurance sector, and even patients across the country is a panel of guests. Bijan Mishra is a consumer activist. We're also being joined by Lokesh, a convener at the Confederation of General Insurance Agents Association of India. We're also being joined by Rupak, Barua, Managing Director and CEO at Woodlands Multispecialty Hospital. Rupak, Mr. Lokesh and Bijan, good to have you with us here on the show. Bijan, let me start with you. It's been a long time coming, many would think. I mean, on one hand, the cost of medical inflation has really hit the roof, but simply the fact that patients in India have had to really look at the difference between being pretty okay and being one step away from poverty thanks to a hospital admission is largely an account of a massive bill that everyone stands to get at the end of a visit or admission. Better late than never, you reckon, these recommendations by the parliamentary panel? Bijan?
Yeah, Jude, yeah, it's a good observation made by the elected representatives. But I really wonder, health is a state subject. All these elected representatives, they need not just point out. They should go ahead ensuring that they bring in a law or regulation to cap such, kind of a pricing mechanism, which is more realistic. And I always believe that if you bring in healthy competition, you see, and in the health sector, unfortunately, the public investment in the healthcare, even though it's quite acceptable, but it's not having a competition with the private. most of the patients opt to go to private, even though government is spending on public, which is more affordable and can be accessed by maximum number of people. And now with Ayushman Bharat coming in and many schemes coming in from the state governments, from the public sector undertakings, from even corporates having group insurance, you see many people get covered. But still we have about 40 crore people who are not covered under any healthcare coverage. And they are the biggest sufferers. And what we need to understand is how do we move towards universal health coverage? And the only way you can move towards universal health coverage is to encourage, having insurance cover either through a public cover like Ayushman Bharat or a private cover through insurance companies. And
Right.
What I would like to tell you here is that these are only recommendations which the parliamentary committee has made. I would suggest that this parliamentary committee moves forward and brings it into the parliament.
Right.
They should
If the
discuss it in
parliamentary
the parliament.
committee moves forward, thank you so much for your inputs. But let's go over to our next panelist. If the parliamentary committee moves forward indeed, and if the room rates are capped to the nearest three-star hotel in the locality, Mr. K.C. Lokesh, help us understand what is the kind of impact that we will see on insurance premium, because everything in the hospital is in fact decided on the room rates, and as the room rates go higher, of course, the charges of the doctor's visit and everything goes up. So tell us more.
Yeah, Ms. Shivani, there are few things which we need to understand. Once any patient goes to the hospital, the bill will be based on the room rent he opts. If the person is having a policy for 5 lakhs or 10 lakhs, he will be entitled for 1% of the room rent. If he opts for a higher room rent room, then the bill will go up. And especially the parliamentary panel has compared the room rent with the nearest three-star hotel. If you take all the major metropolitan cities and tier 2, tier 3 cities, the single room rent across the country, it's around not less than 10 to 12K. For most of the policy holders, retail policy holders who are below who are not HNIs, who are middle class people who are taking policy, for them it becomes very difficult, because when the claim crosses the limit of the room rent, they will be made to pay proportional deductions. See, for example, a person has got 5 lakhs policy, takes a room rent of 10,000. If the claim is around 1 lakh, the settlement from the insurance company will be proportionately deducted according to his room rent. So this will affect the consumer also, the client also, the policyholder who has got health insurance also. And one more complaint or a grievance we can see with most of the patients or policyholders is, whenever they go for a twin sharing room or general ward, the rate will be different.
Right.
When they go for a twin sharing room, it will be different. When they go for a
Positive, is it a positive step is what you're looking at? Help us understand that.
On behalf of industry, as a important stakeholder of the industry, we welcome this move by the parliamentary panel, whatever they have recommended. As Bijan sir said, it has to go to the parliament. For your information, Medical Establishments Act, which was passed in 2010, only 12 states have adopted. Even the insurance industry and the regulator is demanding for a national health regulator, which has not seen the day of the light of the day.
Right. Thank you for those observations, Mr. Lokesh. Mr. Barua, coming to you next. The numbers don't lie, do they? Let's take the instance of, Max Specialty Hospital in Lilavati in Mumbai, Nanavati Max Hospital, I beg your pardon, at Vilpal in Mumbai. A private room per day is anywhere between 6,000 to 12,000 rupees. The nearby three-star hotel is 2,500 to 4,500. In Delhi, Saket, the Max Super Specialty Hospital, 7,000 to 11,500 per day is the room rate. The nearby five-star hotel, three-star hotel is about 3,500 rupees per night. In Chennai, where I'm from, the Apollo Proton, 16,000 rupees per night for a mid-range room. The nearby three-star hotel is not more than 6,000 rupees. Surely, some regulation must be brought in with regard to these inexplicable prices. There is no other way to understand as to why hospital rooms are being priced this way. Perhaps you can make some sense of it, Mr. Barua. Help us understand.
Yeah. Thank you for raising the question. First of all, I would like to mention one thing, that is your hospital is not a hotel, or healthcare is not a commodity. That we need to first understand. Now, if we are talking about your healthcare industry, healthcare cannot be compared with a hotel industry. Not that is a 3-star, 4-star, 5-star comparison. It cannot happen. Because you see, first of all, we treat the patient. We deal with a human life. And it's not that like a hotel, that's a person is visiting for some leisure or for some official purpose, but that's not the end of it. Now, if you talk about this, your healthcare pricing determined accordingly. A hospital cost is a clinical capability, is a technology, is a manpower, and infection control, emergency readiness, and complexity of cases. So not the appearance of a room. So usually a hotel is a room where how is the hotel, how is the lobby, how is this your services and all. But the hospital is actually a clinical outcome. That's a measured by a clinical outcome. Is a good or bad hospital determined by a clinical outcome. Now, if we talk about managing of a hospital and managing of a hotel, if you talk about investment in hotel bed and a hotel room, or investment in a hospital bed, a hotel room cost you, if you are talking about a 3-star hotel, is a cost you around, maybe a single room will come up around maybe 50 lakhs, 70 lakhs. I'm just saying motamoti other than the land cost. But a hospital to build, it costs you at least a 2 CR to 3 CR, 2 crore to 3 crore per bed. So there is the difference between the investment part. Now, if you talk about the manpower cost, a hotel, yes, of course, you are talking about that there are the additional charges that will be given by the laundry or the housekeeping or this your F&B and all. But the question here, in a hospital, one manpower, a hospital, one single bed needs 7 manpower, 6 to 7 manpower to manage. But in a hotel, it's a one employee or one staff can handle one bed. Means your 100 room a hotel can be managed by 150 your staff. But in a hospital, it has to be almost a 100-bed hospital has to be 600 to 700 employees to
Mr. Barua,
manage.
if I may for just a moment, sir. I understand this analysis that you're bringing about with regard to the differential that exists in costs involved in setting up a hotel versus a hospital. However, the clinical aspects of this are being recovered anyway by way of separate costing and a separate billing, because the patient pays for the room and the patient then also pays for multiple clinical services. So how does that come into merely the room occupied by the patient? Or correct me if I'm understanding this incorrectly. Surely the room is a room irrespective of whether it's a hotel or a hospital, and the other costs can anyway be recovered by way of the treatment itself. Why is the room per se being priced this high?
Yes, right. But you have to understand, a healthcare, a hospital is managed by a total ecosystem, a total infrastructure you will have to create. It's the medical infrastructure, clinical infrastructure you will have to create. It's any hospital now, they are investing a sizable amount in terms of clinical investment, rather than I'm talking about the medical infrastructure. You will have to create, where is the hotel is not required. But this clinical, your investment or the medical investment, it is a part of the patient is coming for the room as well. So now the question here, a patient, when we are dealing with is a serious patient, a critical patient, patient needs a lot of infrastructure, not that staying in a room. Not that he just came here, just he is attended by some kind of a F&B team or the housekeeping team. He's being attended by.
I could see Bijan Mishra over here raising his hand. So I would like to go over to him. And also one point I would like to make over here is that 15 years ago, when you would enter a hospital, it was like the most depressing place in the world for anyone, even the caregiver, the patient. But now you enter a hospital, any good, decent hospital in Mumbai, you will see a Starbucks, you will see a nail spa, you will see, like, hair spa, a salon. All the possible, luxuries in the world are available in that hospital. Are these costs passed on to like an average consumer? Bijan Mishra, your point, and also give us an input on this.
So, Shivani, the most important aspect is you have to bring transparency in the pricing mechanism. That is number one. And transparency can only come when you enact a law and you compel the service provider to come out very clearly with all the cost factors and how they're, bringing in terms of the costing for each and every service. Now, of course, I also agree that you can't, compare apple with oranges. Now, what the parliamentary committee had to recommend was that please bring down, develop a lean mechanism, give a lean approach to hospitals, like you just now mentioned. There's a huge difference between what we used to see a private hospital earlier and what we see now. Every corner is being used for commercial purpose. Now, earlier it was not like that. Even the private hospitals, charitable hospitals, government hospitals, made sure that the hospital is made comfortable, affordable, accessible, and as per standard, which is unfortunately in our country is not there. There is no mandatory standard till today. And my panel member did mention, Lokesh, about the Clinical Establishment Act, which got enacted in 2010. Till date, not a single state has implemented it. Of course, more than 18 states have notified it. They claim that they're implementing it, but it is not implemented. It's all on knee-jerk kind of an approach. What I'm trying to recommend is that first you set up a standard, then you start doing a costing in a very transparent manner, like the parliamentary committee members have suggested, that why don't you bring the room rent equivalent to a 3-star hotel which is in the vicinity. Why they have mentioned that is because the land rate would be same, the infrastructure would almost be the same. So what they are trying to say is make it lean, don't make it too extravagant. Don't try to bring in a 5-star culture in the healthcare delivery system. But of course, as I again say, being from patients' angle, that if I can afford it, why not I should get? So there is a choice given to the patient. Let the patient decide what is that they want. They want a 5-star, they want a 3-star, they want a 2-star, they don't want any star. It is up to the patient to decide.
That's a very interesting point, Bijan. And in the world of free market economics, surely the demand and supply, of hospital rooms will surely play a big role in determining how that pricing and how that offering is established. You know what, Mr. Lokesh, I must check in with you on this. Net, it's a big positive for the insurance sector. Would it not be? Because any conversation we have with insurance companies, medical and healthcare inflation is almost always a big factor that weighs in, on pricing, on margins, on revenues. So surely this must be a huge relief. You'd expect most companies to be quite happy at these recommendations and hope for its passage, Mr. Lokesh?
Mr. Jude, definitely it's a positive move. Even General Insurance Council, with the support of regulator, the common empanelment has started. Now we are driving towards a single rate across the country for all the companies. Even I would like to raise one question with Mr. Rupak Guruvaji. If you stay in a 5-star hotel, if you stay in deluxe room or in presidential suite, the charge for a coffee will remain same. But in most of the hospitals, if you are in general ward and if you are in suite, the rate itself almost 3 to 4 times for the services. For the same nursing service, for the same doctor visit, if a cardiologist visits in general ward, it will be 1,000 rupees. If it is in suite, it will be 3,000. It's almost 2x or 3x.
Right. Right. Excellent segue for my next question to Mr. Barua. In fact, help us understand, and this is purely for our understanding, help us understand, how will cutting this room revenue lead to some of these markup, uncapped medical, costs that, we see on a regular basis in many bills. If we check it, monitor it closely, that there are some, some markups or some, consultations which are hidden inside the bill. And then help us understand the impact on, the talent retention of that particular hospital. What will be the impact on the talent retention, surgeon fees? How will it affect that?
So far, I think you were talking about this, your hidden bill and all. I think there is a very clear cut, there is a regulation, which we also recommend that regulation has to be there. Transparency has to be there in terms of billing procedure and all, unethical billing. Nobody is supporting that. So it's there is other statutory bodies who can handle this. That's the unethical practice and all. But now talking about this, your differential of pricing and all, there is a scientific mechanism there as well. That is the economics of a healthcare. That is, if suppose there is for any kind of a procedure, it's 100 rupees. So for the economy patient, we charge 70 rupees. For the twin sharing room, we charge maybe 80 rupees or 85 rupees. And to make this the single room or the presidential suite, which we are talking about, that can be around is maybe 110, 120%. So that ultimately, in an average, if we take the median of the price part, that will come to 100. So that is the mechanism. Suppose the 100 rupees, if we go on charging to the economy patient, that's a question of the whole thing we are discussing today, the affordable healthcare. Affordable healthcare will not be there. So that is the mechanism of a scientific process. So that is a different hospital to hospital, it differs, but it's a basic discussion is here only. That is a differential pricing is there in place on a scientific basis and in a very, very reasonable way that we implement to any of the patient.
For sure, gentlemen. I'm sure this is a discussion that we could keep having for quite a while, but the discussion and discourse on the rationale behind hospital room pricing is well and truly on, at least thanks to those recommendations put forth by the parliamentary committee. But on that note, Mr. Barua, Mr. Lokesh and Bijan, thank you so much for joining us on India Tonight to break down some of the insights around this very important conversation. Great speaking to you, gentlemen, on the show today. And on that note, we'll slip into a short break, but India Tonight will return on the other side, so keep staying tuned to ET Now.